name is Jo Miller, nurse practitioner and certified diabetes educator, and we're here today to do a foot exam on our volunteer patient here. And one thing that is the most important thing in preventing foot problems is daily inspections. So we want to start off by telling our patient that they should inspect their feet daily. And diabetic neuropathy is one of the first complications that appear if you have diabetes. So the patient may not know that they have neuropathy. So that's why it's really important that you do this foot check on them and kind of teach them preventive measures that will hopefully prevent them from having an ulcer or potentially an amputation. So with that in mind, when the patient comes in, hello, Mr. Airman Loth, how are you today?
Good, ma'am. How are you?
That's fine. I am good.
Okay.
Glad to see you. So we're here for your annual foot exam today.
Okay.
And I noticed that you're wearing really good support shoes. And that is really good, especially if you have diabetes. Because if you have shoes that don't have support, or if you have open toes, not good arch support, you're at risk of getting pressure ulcers on your feet, and then that creates calluses. So we want to make sure that they always have good shoes. And do you change your socks daily?
Yes, I do.
That's good. So that's really also good because you don't want to get foot fungus.
True.
So let me put some gloves on. And for time purposes, I've already washed my hands. Some gloves. Have you ever had a foot exam?
I have not, ma'am.
Okay. Well, I will explain everything as we go through it.
Okay.
Well, one thing when you're inspecting your feet, you just want to make sure that you don't do any self-surgery, that you want to cut toenails right across, not too deep. You want to look at the toenails and make sure that they're not cut too short, and that they don't have any fungus growing under them. Visually inspect the foot to see if there's any obvious deformities. And I will check for warmth of the toes, make sure that you have good feeling and good sensation.
Okay.
And I'm also going to check your pulses.
Yes, ma'am.
I'm going to check your dorsalis pedis and the post-tibials, check for the skin for warmth. And then I'm going to check between the toes to see if there's any fungus growing between the toes. And some of the obvious places of calluses are at the balls of the feet or the heels. And do you wear shoes all the time? When you first get out of bed, that's the most important thing you can do, is put some shoes on.
Yes, ma'am.
And flip-flops are not very protective, so if you can have something with closed toes, that would be good. Calluses, under calluses, it's actually reddened, inflamed tissue, so if you have calluses, we need to get rid of those or send you to a podiatrist.
Okay.
So if you notice anything abnormal in the foot exam, let the provider know so that that can be addressed at their visit. So at this foot exam, what we're going to use is a thing called a monofilament. And it is not a needle. And just so you know, this is what it looks like.
Gotcha.
And if you want to touch it, okay. All right. Now that's not sharp.
No, ma'am.
Okay. So what I'm going to do is I'm going to ask you to close your eyes.
All right.
And I just want you to tell me if I'll ask you, do you feel it? And you say yes or no.
Okay.
Okay. Okay. So are you ready?
Yes, ma'am.
Okay. Do you feel that?
Yes, ma'am. Yes.
Feel that?
Yes.
Okay.
Yes. Yes. Yes.
Good job.
Yes.
You feel that?
Yes.
Okay. And you feel that?
Yes, ma'am.
Okay, very good. All right. As you see, when I did the monofilament, you kindly bend it just like the form of a C. So that gives it the 10 millimeters of pressure that's, that you're applying to the back of the foot so that they get the proper sensation that you're looking for. Well, that completes our foot exam today. And with that, we'll have a little prevention sheet that you give to the patients, and then you can document that for the patient's visit. Thank you very much.
Thank you, Ms. Miller. Thank you.